Then you realize what has happened. So how do you introduce is that you hold it, you hold it approximately 5 centimeters and you don't poke it inside. Okay, you will see my finger movements. And always remember, these are all hydrophilic wires. What do you mean by hydrophilic is that absorb water and they function much better when they are moist. So what I am doing, I am holding and see, my movement is going to be this. Can you see my finger movement? That's how I'm going to introduce. I'm not going to jab it. I'm going to rotate it. Why? Because when the wire enters, sometimes it's above the wall like this. Okay, but when I rotate it, it will find a way and it will go. So now we are going to. Okay? Yeah. Everyone saw that? Now what I'm going to do is that, one more thing, when the blood comes, don't touch this. Let the little blood go, because if you touch that, it may just move itself, because the vein is very small. See how it moves. Okay? Saw that? And once it was pulled, then your job is done. Okay? Now what do? We confirm. First system, battery. The compartment, more is the chance of collateral damage. You understood? Because see, you can't have a laser which is going to only burn the vein. Some heat is definitely going to have a lateral spread. So as you lower down the zone, your risk of collateral damage keeps increasing. How do you counter that? Tumescent is there and you lower the energy. When you start firing, zone A will have a different energy. Zone B will have lesser. Zone C will have. Got it? Everything clear? Zone A, B, C. How do you decide if there are two indications to puncture in zone C? What are those two indications? If the patient has an ulcer or lipodermatous sclerosis, blackening. If the patient has that, I will take a puncture in zone C. If the patient has none of the two, I will take a puncture in zone B. Why that? Because in zone C, like I said, see, this gentleman here complains of that heaviness and pain and all that, correct? If I take a puncture in zone C and I end up causing significant collateral damage related pain, patient is more upset. I said, he said my pain was here. Now we have aggravated 1 centimeter upwards, approximate range. Just a freeze, please. Okay? Now we are skewing them. Everyone can appreciate the GSV. See, remember these pictures. This is how your section should look, not like this. See, this is Adha. See this. Your entire GSV has to fill up the entire screen. So, like I said, any visualization is always in the axial plane. Any intervention is always in the longitudinal plane. Like putting your needle or giving tumescent, all that has to be in the launch plane. Now keep a watch. Everybody eyes on the screen, please. Just a depth on. Okay, everyone can see the GSV. Everyone can see my needle?
Yes.
Still see my needle? Still see my needle? What happened? Why did I do that? Sending everyone. Why?